Welcome back to Behind the Headlines. For the past 13 months, Missouri has been rechecking the eligibility of Medicaid recipients, all of them. And since then, 136,000 children and teens have lost their coverage, and not always because of eligibility. Clara Bates with the Missouri Independent News Service joins us now. She has looked into this, and welcome back, Clara. Always good to see you.
Thanks for having me.
First, let's talk about the personal impact, losing coverage. Even if that is temporary, what health issues would these kids be dealing with?
Yeah, I think often we think of kids as just, going to the doctor once a year for a checkup, and certainly that's true of some, but it's also important to remember that kids have chronic health issues like diabetes and asthma. And when I was speaking to these pediatricians and families, I heard about children who could no longer afford their asthma medication, about one girl who actually ended up in the ER twice because her condition sort of deteriorated so much without her medication. So those can be some of the personal impacts. There was a boy who had to delay his cochlear implant. I heard about him through a different pediatrician. And as a result of that delay, he had different developmental delays because he couldn't hear, for a year of life. So the impacts can be pretty severe.
So is this a paperwork and a processing problem in the Medicaid system? Is that why this keeps happening or is happening?
Yeah, a large percentage of the people who are being removed from Medicaid are for those paperwork issues. And sometimes the blame can fall on the side of the parents. Maybe they got the forms and didn't understand them, or, they were overlooked somehow. Maybe they moved and didn't get the forms. There have been reports that the state sometimes seems to lose paperwork. So it's a little bit hard to say exactly who's at fault, but a lot of it is paperwork related when the state is trying to redetermine their eligibility. And for whatever reason, they don't get the paperwork back. So that is a large part of the problem, but it's certainly not the case that a lot of the people I spoke to had suddenly come into a lot of money. They're still very low income. And even though they're being kicked off this program that's supposed to help them get health care.
So let's talk a little bit about some of the other side effects, like with preventive care, which saves money, and dental work, when done regularly, saves money.
Yeah. One woman I spoke to in a more rural part of Missouri said she hasn't had coverage for her teen kids since January, and she's thinking she'll have to get her son's braces taken off because they haven't been able to go to the orthodontist. So you can imagine that those kind of things can just set a child's health back for a while, and their treatment back. And other preventative measures like vaccines. Sometimes parents will have to make difficult choices if they're uninsured to get the vaccine, but not to test for other things. Like if a child is underweight and the doctor wants to run tests, but you don't have insurance, you might wait on that. And so I just heard that parents have been put in kind of difficult situations, sort of trying to calculate what they can and can't afford.
So when parents call the state to get their kids back in, if they, can get through, and the kids are missing appointments, what barriers are they still running into?
Yeah, it's pretty hard to get through to the state. There are a number of community workers, like at federally qualified health centers, which primarily serve more vulnerable populations. So I heard from those staff who don't work for the state that they feel participants are often calling them because they can't get through to the state, and calling them over and over and saying, why hasn't my application been processed? But really the onus is on the state. There are hours-long wait times for people who call the number for help. Sometimes if you go in person to an in-person resource center, you'll still be directed back to the phone lines because that's just the way they've done it for a few years now, I think, with the staffing cuts, especially after the Great Recession. So just the way that things are set up now can make it rather challenging to actually reach a human being when you're a participant in this program. There are a number of bots that answer the phone and stuff before you can get to a real person. So I think you can just encounter a number of hurdles, and it can make it hard to understand why you or your kids have gotten removed from the program in the first place.
Tell us about the mom in your story that had to work through what could be described as the ripple effects of this breakdown. What happened?
Yeah, she's based in Kansas City, and she and a few of her children lost coverage. And they all have several health problems and had to navigate in that time what they could and couldn't delay. And so I was meeting with her on the day when she actually heard she got coverage back, which seems like it would be great news. And, the problems are all over. But that's not quite the case because she had like hundreds of dollars of medical bills from the time that she was uninsured and had to get care for her kids that she couldn't delay. And so now she needs to call the state and try to get that reimbursed through Medicaid. And it's also challenging because for these specialty appointments, they're booked months out. I think we've all experienced that. And so if it's set her back several months. And it's, of course, not just kids. She is recently postpartum. I think she had a child a month or two ago, and she had experienced several falls during her pregnancy and needed to get physical therapy because she's having trouble walking and her back is injured. And I think she was saying because her physical therapy appointment was canceled and delayed because of her lack of coverage, she won't be able to go in until September or October. So you can imagine that just the stress of all of that continuing is challenging.
Clara Bates with the Missouri Independent News Service. Thanks for joining us, Clara. You can see her reports online and also on the social media, as well as this conversation on KY3.com and the KY3 News App, also on Roku and Fire Stick and Apple TV+. Clara, as always, we appreciate your storytelling and your reporting, and we will see you again soon. Thank you.
Thank you.